This webinar is one of 3 developed for the Washington Department of Health AFIX program. Tips and tools for working with clinical practices builds on the concepts presented in the first 2, Quality Improvement 101 and Strategies to Increase HPV Vaccination Rates. I'm Barb Frankowski, and I'm a primary care pediatrician with a special interest in quality improvement, and I work with VCHIP, the Vermont Child Health Improvement Program. Chris Pellegrino was instrumental in helping with this webinar, and she's a Quality Improvement Associate with VCHIP. My goal today is to encourage you to think about the quality improvement strategies you've learned about and why it may be important and helpful to use some of these strategies in the AFIX visit. What can you do to build more interest in the visit? How can you encourage the practices to get team participation? And most importantly, how can you operationalize QI so that it comes alive for the practice in a practical way? You already help the practices choose the strategy that seems most relevant to their needs. How can you engage them in setting their own aim? Can you help them map the process in their own office system? Help them understand how to pick a measure and walk them through building their first PDSA cycle so that they can test. Of course, you may not have the time to do this with every practice at each AFIX visit, but think about where you would be most comfortable starting. So, the problem is, despite HPV being an extremely effective vaccine, and despite the fact that it has been available for many years, rates are still low. AFIX visits help by working with practice teams to be knowledgeable about their actual rates, understand the gap, diagnose the problem, and consider strategies and solutions. But you may have seen that the visits are not always as effective as you would like in helping practices make changes to improve the problem. So, how can you really help them change? You can use the model for improvement that you've learned about to help the practice understand how to change. Show the practice how to break down the process into individual steps. Know that what you are trying to accomplish by setting an aim, you will use measurement to know that you are making an improvement. Choose an initial strategy and then generate ideas of what you can change. Test small changes in PDSA cycles. So, why use these QI methods? Because they've been shown to work. Some practices can make changes just based on information that one of the pediatricians learns by reading a journal article or attending a grand rounds. But practices are complex systems that require more than that. 2 practices in Washington engaged in an ongoing, established 6-month multi-state QI project. The initial learning session and follow-up sessions took place via webinar with participating practices from other states. Each practice worked as a team, used PDSA cycles, and submitted monthly data that they were able to review. The strategies used were the same as what you encourage in the AFIX visits: strong provider recommendation and decreasing missed opportunities. The 2 Washington practices were able to almost double their rate of HPV series initiation and their rate of HPV series completion in just 6 months. In addition, the practices were able to decrease missed opportunities significantly. The AFIX visit system is not designed to be this intensive, but using some QI methods could help make it more impactful. Research has shown that to impact clinical change, you need something more intensive like QI. So, let's walk through step by step some of the methods you might be able to use, including a challenge to the practice: what can you do by next Tuesday? First, build interest. What's in it for the practice? Encourage team participation. Operationalize QI for the practices. Choose the strategy, set the aim, map the process, pick measures, build PDSA cycles. Again, We know you won't have time for everything, but hopefully you'll be able to be excited to try one or more of these QI methods. So, I've never personally done an AFIX visit myself, but in looking at the timeline, I had some thoughts of where some of these ideas might fit in. During the outreach to sites, you might want to mention what's in it for them. During the pre-visit prep, you might suggest the team members and ask the practice if they have any experience with QI in the past. During the visit, you're going to show the PowerPoint plus have them choose the strategy, set the aim, examine the roadmap, pick measures, build a PDSA cycle, and then the challenge. The follow-up emails are done at set times. Within 7 days, you might be able to check on the PDSA cycle. And then the once-a-month emails might suggest next PDSA cycles. The follow-up assessments, where you present the data, would also be an opportunity for a root cause analysis on the 5 whys, which we'll talk about later. And at 6 months, you have an opportunity to celebrate the gains and help them keep up the momentum. Building interest is probably one of the most important and difficult things to do with a busy practice. Why should the practice do this? What's in it for them? They can protect their patients from long-term consequences from HPV. There might be financial incentives from health plans. It increases the practice's chance of receiving gold or silver immunized Washington status for adolescent immunizations, and HPV is a HEDIS measure. Before you go for your visits, as a group, you may want to brainstorm other incentives for practices. Remember that physicians and other healthcare providers can be very competitive, and if they hear that a neighboring practice is doing something differently, they may be encouraged to try it also. So, who are the influential opinion leaders in your area? Are there local practices who've been successful? Are there any AAP chapter leaders in the practice you'll be interacting with? And you can find these names on the Washington American Academy of Pediatrics website. Is there anyone at your health department who's a real rock star with pediatricians who would be able to light a fire under them? And it's good to know that Dr. Kyle Yasuda, a Washington pediatrician, is the AAP president-elect and will be president of the American Academy of Pediatrics next year. So mention any of these carrots that may be relevant to a practice when you make the initial outreach to the site. It's also been shown that having a whole practice team involved is key to making change happen. Why not suggest team members when you talk to the practice point person during pre-visit prep? The team should include, or could include, the practice manager or nurse manager, an immunization champion, a nurse, a screener, a medical assistant, front desk staff, a physician champion, and look for someone who's passionate about adolescent health with the HPV vaccines or someone who's passionate about immunizations in general. Encourage the whole team to be present for the whole visit, not just a PowerPoint. Be sure the practice point person understands that without team engagement, significant change is much less likely to happen. So, you've gotten the practice excited and the team shows up for the visit. How can you operationalize QI during the visit? We'll start with choosing the strategy that the practices will try. Much research has determined that these are the major strategies with a strong evidence base. Another webinar in this series, Strategies to Improve HPV Vaccination Rates, goes into greater depth on these strategies, but basically the primary goal is a strong recommendation for HPV vaccine, and the secondary goal is reducing missed opportunities by using a reminder recall system, using standing orders, and/or using provider prompts. Here are the questions that you review with the practice to determine what they are already doing and what they can improve on. Help the practice think about each of the strategies that we know improve the quality of immunization services. Have a reminder recall process in place for adolescent patients. Offer walk-in or nurse-only visits. Regularly measure your clinic's immunization rates. Schedule the next vaccination visit before the patient leaves the office. Contact patient or parents within 3 to 5 days of a no-show visit to reschedule. Have a system in place to schedule 11 to 12-year-old well visits. Have an immunization champion in the clinic that focuses on quality improvement. Regularly document vaccine refusals and reasons for refusals. And then strategies to improve immunization information system records. Report all immunizations given at your clinic in the IIS. Report historical immunizations to the IIS. Inactivate patients in the IIS who are no longer seen at your clinic, and use the IIS to see which immunizations are due at every visit. Help the practice team pick one strategy that they think would be the easiest or most impactful place to start. If you have the team together, you may want to have them pick a second strategy also. Next, let's talk about setting the aim. A way to engage the practice is to help them articulate the aim in a way that makes sense for their practice, given their immunization data and the strategy they have chosen to focus on. This aim may be more specific than the general aim. So you want to get the practice team involved, get them to think about what they want to accomplish, and picture the end result. The aim should be SMART: specific, measurable, attainable, relevant, and time-based. Consider using a handout of this slide so members of the practice team can work on writing their own aim statement. So here's an example of how you can get people involved with the piece of paper and filling in their own aim statement. So this could be the aim statement for a practice who has good HPV initiation rates, but with poor HPV completion rates. We will increase the percent of 11 to 17-year-old patients who have not completed their HPV series contacted via the reminder recall system by 50% over our practice baseline rate by September of 2018. Next, let's think about mapping the process. Process flow mapping. A map is a map of the process. It's a great starting point for the team, and it helps the team gain a common understanding of what's involved in a process. You really need team members that represent all aspects of the practice to do this accurately. For example, you need front desk staff that check the patients in and out and schedule next appointments. You need nurses or medical assistants who screen and room the patients, providers who see the patients and write the orders, and nursing staff who administer the immunizations. So, when you're mapping the process, define the process to be diagrammed. So are you going to do the whole visit from check-in to check-out, or are you going to concentrate on a different part of the visit? Decide on the boundaries of your process. Where does it start? Where does it end? What level of detail do you want to include? Like I said, get the right people there and brainstorm the identified activities. You can use sticky notes that are arranged in a proper sequence, and then draw arrows to show the flow of the process, and then review the process with all involved for accuracy. So for example, if a front desk person was not the person who was involved in the team, they need to look at that process flow map to make sure that it's accurate. So here are some examples of how you can do the process flow mapping either on a whiteboard or on a piece of paper that the team members fill out. A skeleton of the process really helps to get them started if you don't have a lot of time. So here's a process flow map of missed opportunities. And we're starting with where the patient checks in and where the patient checks out. So just an example of how the practice fleshed things out. When the patient checks in this particular practice, there was no pre-visit planning, so the parent or the patient was not alerted to the need for a vaccine. When the patient was roomed, the screener has to check the temperature, the blood pressure, the weight, document the chief complaint, and also start checking immunization status. And then will alert the provider if a second HPV is needed. The provider in the encounter enters the room, obtains history, and does a physical exam relevant to the chief complaint, makes the diagnosis, and discusses the plan. And then the provider needs to discuss HPV and write the order. However, in this particular practice, the provider usually does this at the very end of the visit. So when the screener has to administer the HPV at the end of the visit, the screener is often busy rooming the next patient, so sometimes the HPV doesn't get given till later, and sometimes the patient leaves before the HPV is actually given. And when the patient checks out, the next health supervision is scheduled. Hopefully the next HPV vaccine is scheduled if needed. So if the practice already has some experience with QI and has done process flow mapping in other situations, you can help them construct a more sophisticated map. This process flow map looks at the steps in recalling a patient who needs a second HPV vaccine. So starting at the upper left-hand corner, the practice will generate the list of patients who need a second HPV vaccine, call the patient using a script that was developed, and then does someone answer the phone? If yes, the appointment is made, and then the patient is added to the reminder list to text or call before the appointment as a reminder. If no one answers the phone, there's a scripted message that's left on the answering machine, and then if the patient calls back, then they make the appointment. If the patient does not call back, then they get added to a tracking sheet, and if there's no response within a certain number of days, they get back on the list to be called again to be reminded of the second HPV vaccine. Next, we're going to focus on picking measures so that a practice can figure out if improvement is actually happening. The outcome measures are often more broad and represent the patient impact. These are often set by the Department of Health. So for example, one outcome measure could be the percent of 11 and 12-year-old patients who initiated the HPV vaccine series. If the problem is more with the males getting the vaccine, the outcome measure could be the percent of 13 to 17-year-old boys who've completed the HPV series. The process measures are often more specific and are practice specific, depending on what strategy the practice has chosen to focus on. So they may want to look at the percent of 11 to 12-year-old patients who are messaged via the reminder recall system, or the percentage of 13 to 17-year-old boys who are eligible for the second HPV, who were seen in the office during the month of April for any reason, who received their HPV at that visit. This slide shows how measurement fits into the overall change process. So at the project level, the outcome is the rate of HPV vaccine series completion, and the strategy is missed opportunity rates. And then at the PDSA level, how many patients who were called for a reminder recall actually made an appointment for the HPV vaccine. So two different types of measurements. One is more immediate and specific. The other one is the overall picture of what you're trying to accomplish. Finally, helping a practice build its first PDSA cycle can make the process really come alive for them. Here's a copy of the QI action plan that you usually leave practices with. Wouldn't it be great if you could also help the practice team members think through the first PDSA cycle so they'll be ready to start when you leave? If the team has already picked a strategy and have thought about what they can easily measure, they're ready to set up their first PDSA cycle. So plan, what are the questions that they're asking, what do they think will happen, who, what, when, and where will the PDSA cycle happen, and what are they going to measure? And then the do part, just do it. Start it next Tuesday. Document problems and unexpected observations, and then study what happened, what worked, what didn't. Compare data to what you predicted and summarize what was learned. And then act, note what to do differently in the next cycle, and then what would be the next steps. So I just wanted to talk through a couple of PDSA cycles because the specificity of them really makes it clear what we're trying to help practices do. Because usually when practices are not familiar with QI and they set up a PDSA cycle, it's way too big. So just little things that you're checking. So here's an example of using the reminder recall system. So here's cycle 1. Plan, the front desk administrator will call 10 patients who are turning 12 this month who have not initiated the series. So do, they make the calls. Study, no one answered any of the calls. 2 numbers were not active. The person left 8 messages and only one person called back. So the act part, you're going to adapt this. Try calling later in the day when more people are likely to be home. So cycle 2, the front desk administrator will call 10 patients after 4 p.m. Do, make the calls. Study, 5 people answered, 2 made appointments, left messages for 5 and 1 called back. And the problem was that people didn't know what their schedule was. So adapt, have a set day and time for a vaccination clinic when calling. So cycle 3, the front desk administrator will call 10 patients after 4 p.m. to see if patients can come to a vax clinic on Saturday between 10 and 12. Do, the person makes the calls, and then study, 5 people answered, 4 could come to the clinic. Left messages for 5 people with that specific information, 2 called back and were able to come to the clinic. So are you going to adapt this? Do you want to make any more changes? Do you want to adopt it? Those are the things that you'll decide as you continue to fine-tune your little PDSA cycles. Here's another example, PDSA in action, missed opportunities. So plan. The front desk staff will identify all patients 11 or older who are coming to the office next Tuesday who are due for their second HPV. HPV info will be placed on those charts. So they did that. 10 eligible patients came to the office on Tuesday. 5 were recognized and flagged by the front desk staff as needing the second HPV and received the info sheet, and 2 received the second HPV before leaving the office. So what happened? One person at the front desk thought HPV was only for females, so did not flag any of the males coming in. Another person at the front desk said they were too busy and didn't have time to check all the charts for eligibility for the second HPV. And the screeners didn't always see the HPV sheet on the chart, so they didn't alert the medical provider. So what are you going to do? This is not really an appropriate task for for this practice's front desk staff. Screeners should determine who's eligible and alert medical providers. So this plan is abandoned, but you're going to try your second PDSA cycle. So this time, screeners will determine which patients are eligible for the second HPV by chart review while rooming the patients. Screeners will leave a note in the chief complaint part of the chart to alert medical providers. So 7 of 10 eligible patients were identified by the screeners. 4 of those 7 received their second HPV before leaving the office. So what went wrong? The screeners have a lot to do when rooming patients. They get a weight, a temp, a blood pressure, they get the chief complaint, and they didn't always remember to check HPV status. Medical providers did not always notice the message in the chief complaint part of the chart. So what are you going to do? Screeners will add check HPV status to pre-visit planning instead of doing it while rooming the patient. They will alert medical provider during the huddle so that order for the HPV can be written in advance. So you're going to adapt this and start in your next cycle. Wouldn't it be fun to ask about the PDSA cycle when you check in with the practice in a week? If talking by phone to a point person is not feasible, perhaps you could ask about it in the email you send. Each PDSA cycle leads directly to the next one. You can encourage new PDSA cycles and ask about them in your monthly emails. The practice learns from each PDSA cycle what worked, what didn't, and what needs to be tweaked, and uses this knowledge to plan next steps. Keep encouraging them to start small, keep it simple, measure just enough information to inform the next step, and incorporate the PDSAs that work into new office systems. Think about how you give feedback at 3 and 6 months. It would be great if you knew what changes the practice was making so you could link it to the feedback. Giving feedback in a run chart like this lets practices see the impact of changes they are trying out. So for example, in this chart, here's what happened when cycle 1 took place. Tried to have the front desk staff identify patients needing HPV. Not realistic for them to do this, so there wasn't much change. Cycle 2, screeners identified eligible patients while rooming, but were too busy to do it consistently. So there was a little change there, and by cycle 3, screeners will alert medical providers of need for HPV at huddle, so order for vaccine can be entered in the chart. So let's look at one more tool just for fun, root cause analysis, asking 5 whys. So the cartoon here says, to address this mistake, we must use root cause analysis. I'll begin by saying it's not my fault. So that's not how root cause analysis actually works. So here's an example of asking the 5 whys. By repeatedly asking the question why, you can peel away the layers of an issue and get to the root cause of a problem. Keep asking why until you reach an actionable level. So in this example, you were caught speeding on the way to work. Why? Because you were late for work. Why were you late for work? You got up late. Why did you get up late? Your alarm clock didn't work. Why did your alarm clock not go off? Dead batteries. Why were the batteries dead? You forgot to replace them. So one thing you can do to prevent getting another speeding ticket is get a plug-in alarm clock or replace the clock's batteries at set times before they run out. In this example, you're capturing one answer for every why question asked. Typically, you would have more than one answer for every why question, and each one would be subjected to another why question. The 5 whys analysis is asking the right question at the right time. So let's use an example from our practices. So missed opportunity root cause analysis. The scenario is the 13-year-old boy with a sprained ankle left the office without getting his second HPV vaccine that was due. Why? The doctor didn't order the vaccine. Why didn't the doctor order the vaccine? The doctor didn't know the patient needed the second HPV. Why? There was no prompt in the chart. Why was there no prompt in the chart? The screener didn't know the new process to check HPV status and prompt the doctor. And why didn't the screener know the new process? She wasn't at the AFIX visit and no one told her about the new PDSA cycle that was being tried in the office. So this is actually kind of fun if you have the time to do with a practice to sort of figure out why things aren't working. So you've probably heard many excuses from practices why they can't change. Think about your barriers to change. You only have so much time for the AFIX visit. You may need to step out of your comfort zone if you have never used QI methods with practices. You may still have problems engaging the interests of key practice members at the visits, and I'm sure you can think of many others. Think about these keys for successful change. Awareness. The practice understands why it needs to change their immunization systems. Desire. The practice is motivated to do this change. Knowledge. The practice knows what it can do to improve its immunization systems. Ability. The practice knows how to implement the change. And reinforcement. Reinforcements are in place so the practice sustains the change. So here are keys for successful change for an AFIX visit. Awareness. HPV immunization rates are low. Desire. We can prevent more cancers. We can improve our HEDIS measures and more. Knowledge. Know about the AFIX strategies. Ability. Quality improvement training and coaching. Reinforcement. Celebrate success. If not sustained, provide more training. So the closing challenge. Here's a closing challenge for you. The next time you're doing an AFIX visit, challenge the practice. What can you do by next Tuesday? This can jumpstart the process, and write it down so you can ask them about it the next time, either by email or with a phone call. Challenge yourself. What can you do by next Tuesday? Think about how you can encourage change with your follow-up AFIX emails. Follow up on PDSA cycle, or help with ideas to build the next PDSA cycle. Assist providers and staff in identifying any immediate problems and solutions. Tweak the chosen strategy. Support monitoring goals, and encourage team participation and additional goal setting. Thank you, and I hope you found this webinar helpful. Remember, other webinars in this series are Quality Improvement 101 and Strategies to Increase HPV Vaccination Rates. Thanks so much for listening.